Ayahuasca is a psychoactive brew from the deep Amazon. It's said to stimulate the senses, to alter mental states, and to change the perception of reality. Ayahuasca retreats have recently become popular worldwide, but many people overlook the dangers that undergoing a ceremony can place on them. DMT is the ingredient in many plants, and it's also found in the ayahuasca brews. It's classified as a Schedule 1 substance in most countries, and this means it's an illegal drug with a high potential for harm and no known medicinal use. It's highly advised against using DMT containing ayahuasca brews until future studies determine the safety and the efficacy. Ayahuasca is a chemical complex brew, and it exerts many psychoactive effects on the users. Amazonian folk medicine claims it can enhance emotions and deep introspection and purge the body. Allegedly, shamans have been occasionally using it for spiritual purposes since pre-colonial times. Modern science wants to understand if you can help people with mental health issues, but ayahuasca research has regulatory barriers and it needs to be carefully performed because of the possible side effects. Ayahuasca is a psychoactive brew and it's made from two hallucinogenic plants, Banistoriopsis caapi and Psychotria viridis. Traditionally, this brew is used by the natives of South America for its hallucinogenic properties in their spiritual and their cultural practices. The brew is traditionally made by boiling the bark and the stems of two plants. Archaeological evidence suggests the earliest use of the ayahuasca was more than 4,000 years ago. In the 20th century, the popularity of ayahuasca began spreading around the world because of globalization and religious tourism. Essentially, ayahuasca is a hallucinogenic blend and it causes psychedelic effects. Indigenous people claim it can trigger unique out-of-body experiences. These are sometimes described as a spiritual journey that delivers some sort of advice to the user. Thus, it was strongly associated with shamanism. The ayahuasca-induced state of mind is said to allow shamans to enter a trance state and hallucinate. Ayahuasca has a strong religious and cultural background. It's also been an intriguing literary topic. The McKenna brothers wrote about ayahuasca in their book True Hallucinations. Aldous Huxley wrote about mescaline and other hallucinogenic plants in The Doors of Perception, Heaven and Hell. Despite having cultural significance, the legality of ayahuasca is a controversial issue. Although ayahuasca plants and preparations are legal in the US, their status is unclear. Specifically, these plants are legal since they contain no illicit chemicals. However, brews made using DMT containing plants are illegal since DMT is a Schedule 1 drug. The US Supreme Court has ruled in favor of using ayahuasca plants for religious purposes under the Religious Freedom Restoration Act of 1993. Ayahuasca is also in the FDA's Poisonous Plant database. The ayahuasca brew contains varying concentrations of psychedelic drugs, like DMT and MAO inhibiting harmala alkaloids, depending on the batch. These psychedelic drugs seem to work in tandem to elicit the effects on the brain. The preparation creates an altered state of mind. Users are reported to experience introspective properties such as visions, the recollection of previous memories, and vivid emotions. The ayahuasca brew contains harmine and harmaline, and this appears to inhibit MAOA, or monoamine oxidase A, in the gut. MAOA is an enzyme, and this breaks down certain chemicals and neurotransmitters, like serotonin, DMT, and dopamine. DMT and serotonin have similar structures. DMT is the potent chemical found in many different plant species. It has similar molecular structure to serotonin, and it can be degraded by the MAOA enzyme. Scientists have found the inhibition of the MAOA enzyme allows the DMT to be absorbed into the gut, unmetabolized, and then it enters the bloodstream where the DMT travels on to cross the blood-brain barrier. In the brain, it binds to the serotonin receptors 5-HT1A, 2A, and 2C. Trace amine-associated receptors TAA-R6 and sigma receptors SIG-1R, and this causes hallucinogenic effects. Scientists are also investigating whether this action has antidepressive effects. People administered ayahuasca show increased brain activity in regions that are associated with physical sensations, emotional arousal, and subjective feeling state in the frontal and the paralimbic brain regions. Although most of ayahuasca's effects appear to be subjective to the user, for example, some people say ayahuasca was slightly stimulating, while others report having extreme visions, there's no way to predict what will happen. The following short-term effects have been reported as desirable by users: a feeling of excitement, a change in the rate of thinking, a change in the quality of thinking, euphoria, new insights, hallucinogenic visions, emotional arousal, increased introspection, and mood changes. Some people experience intense anxiety, paranoia, fear, and a reliving of past traumas. Combined with an unsafe environment and untrained facilitators, this can be very dangerous. In a couple of preliminary small-scale studies, ayahuasca improved symptoms of depression and anxiety in people with recurrent depression. People started to feel the effects about 80 minutes after drinking the brew. Symptom improvement lasted for up to 3 weeks, according to the findings. However, there was some potential for tolerance. Additionally, these studies had many limitations. They didn't include a control group and their sample size was small. Results of the only double-blind, randomized, placebo-controlled ayahuasca trial conducted in Brazil were published in PsycholMed in 2019. This landmark study was the first controlled trial to test any psychedelic substance in the treatment-resistant depression. In the study, ayahuasca had antidepressant effects in 29 patients with treatment-resistant depression when compared to placebo. The participants were monitored for up to 7 days after their session. Although encouraging larger, long, multi-center trials are needed, in terms of mechanisms, scientists propose that ayahuasca might target regions of the brain that are associated with emotion processing and motivation, the frontal and the paralimbic areas. Additionally, the chemical DMT in the ayahuasca brews is hypothesized to help people with depression by activating the serotonin receptors in these regions, the 5-HT1A, 2A, and 2C. But this has yet to be determined in humans. Ayahuasca is said to clear the gut and the digestive tract of parasites and alleged toxins, but this remains unproven in humans. Indigenous people said the first step of ayahuasca's effects is its intense purgative properties. These are claimed to physically clear the body of parasites and microbes. By blocking MAOA in the gut, ayahuasca also increases serotonin in the gut, and this can induce vomiting and diarrhea. Harmine and harmaline, the harmala alkaloids found in ayahuasca, are being researched as potentially anti-parasitic agents. Scientists are investigating whether they can chemically kill the parasites and the bacteria, like E. coli and Salmonella, in the cells, but animal and human data is lacking. As a hallucinogen, ayahuasca induces changes in personality and behavior. Researchers wonder if its psychological effects can have anti-addictive implications in the right psychotherapeutic setting. We don't have an answer to this yet, but early results seem promising. The Multidisciplinary Association of Psychedelic Studies in Canada sponsored a study of ayahuasca-assisted treatment for addiction, and the study was observational, meaning that the researchers observed ayahuasca sessions without interfering. The sessions were facilitated by an independent psychiatrist, Gabor Mate, MD. In this study, based on the data from 12 participants from a rural First Nation community, an ayahuasca 6-day retreat reduced the self-reported alcohol, tobacco, and cocaine use. Cannabis and opiate use did not change. Improvements in hopefulness, empowerment, mindfulness, and quality of life were also improved. However, we can't draw any conclusions from such a small study that lacked a control. The safety and the effectiveness of ayahuasca for addiction has yet to be determined in placebo-controlled trials. Some psychiatrists believe that in appropriate contexts, ayahuasca might contribute to substance addiction treatment through interconnected, body-oriented, psychological and spiritual experiences, and this may lead to diminishment in the cravings. While possible, this hasn't been proven yet. Another study suggests ayahuasca can enhance creative thinking while decreasing conventional thinking. Theoretically, this increases psychological flexibility, which can help with addiction. Despite anecdotal stories about individuals using ayahuasca as a therapeutic for certain forms of cancer, there's no human studies available regarding its safety and effectiveness in cancer patients. Similar to psilocybin, some scientists think ayahuasca can help people with life-threatening diseases like cancer to deal with the existential anxiety and fear, but this hasn't been investigated yet. Researchers are investigating if ayahuasca affects the following mechanisms in cancer cells. If it increases the number of white blood cells, lymphocytes and natural killer cells, affects cancer cell growth and survival, and reduces glucose use in the cancer cells. All these mechanisms are purely hypothetical in humans. They've only been researched in cell culture. Many substances have anti-cancer effects in cells, including downright toxic chemicals like bleach. This doesn't mean they have any medicinal value in cancer patients. On the contrary, most substances, natural or synthetic, that are researched in cancer cells fail to pass further animal studies or clinical trials due to a lack of safety or efficacy. The most prominent and immediate side effect of ayahuasca is diarrhea, nausea, and vomiting. Facilitators claim that these purgative qualities should not be considered adverse but intended. They believe the ayahuasca acts as a cleansing agent that expels negative energy of a disease. Still, these can be distressing for people, and they could lead to an electrolyte imbalance. Regardless of the intended effects, the adverse effects of ayahuasca are potentially dangerous and fatal. Additionally, the ayahuasca brew is a complex blend that ranges slightly in ingredients depending on the brew and the region. The various mixtures alter the use, the potencies, the side effects, and the color of the brew. Ayahuasca contains DMT and harmine, and these increase blood pressure, heart rate, rectal temperature, and they dilate the pupils. Harmine also induces tremors in individuals via serotonin. In usual circumstances, ayahuasca is considered to pose a moderate risk for heart and blood pressure problems in most healthy individuals. However, some people develop hypertension after ayahuasca use, and its side effect profile remains largely unknown. Ayahuasca can also elevate certain hormones in the body, like prolactin, cortisol, and growth hormone, and this can cause a rise in body temperature and the rate of breathing. This can also worsen anxiety and panic. Other symptoms include profuse sweating and shivering. When combined with certain foods and medications that increase serotonin, ayahuasca causes serotonin syndrome, and this can be fatal. Symptoms include initial euphoria, nausea and confusion, followed by tremors, vomiting, convulsions, and loss of consciousness. In extreme cases, death can occur. There's been one reported death directly associated with the intoxication of ayahuasca. Additionally, in pregnant rats, ayahuasca is toxic to both the baby and the mother. The toxicity displayed appears to be dose-dependent. Ayahuasca is used primarily for its psychological and emotional effects. However, these are often unpredictable, and people are rarely equipped to deal with them. Particularly during casual ayahuasca use, individuals can experience unbearable emotional intensity. DMT generates aversive psychological effects or short-term psychotic episodes. Similar to other hallucinogens, individuals with a personal or family psychiatric history of psychotic or manic episodes are likely more at risk of developing these episodes when using ayahuasca. It's still unclear why some people suffer psychotic reactions to ayahuasca. Extreme panic, paranoia, and other intensely negative emotions have been reported. According to anecdotal data, ayahuasca can cause traumatic memories to re-emerge, and this can be dangerous and scary for many people. Due to the popularity, facilities that specialize in ayahuasca retreats in South America are growing in number, and more of these retreats are being tailored towards Westerners. In general, the format of these retreats may consist of night-long ayahuasca sessions with 1 to 2 days rest, artistic activities, and academic presentations. Subsequent ayahuasca sessions follow the period of rest. People say they join the ayahuasca retreats for spiritual or personal development, emotional healing, or the development of personal self-awareness. Ayahuasca retreats usually involve an Amazonian shaman leading ceremonies or sessions where a tourist drinks ayahuasca tea, subjective to an intended psychological or physical effect. However, the experience and the ethics of all shamans and facilitators leading these retreats are unknown. People who undergo retreats are putting their whole life in the hands of the shaman or the facilitator. There's been several reports of retreats being offered by untrained individuals. Issues with brew preparation, dosing, and managing the side effects of ayahuasca, aside from other risks that put participants in serious danger. It's also been shown with other psychedelic drugs that act on serotonergic pathways that they lead to a state of suggestibility, meaning that they could easily be manipulated by the facilitator. Even if the facilitators were knowledgeable, there's not enough clinical data about the ayahuasca to yet determine its medicinal potential, especially in the long term. Additionally, remember the psychological disorders like depression, anxiety, addiction, and PTSD should be managed by a medical professional. The following are genes that are linked to similar pathways as the ayahuasca. This doesn't mean that these genes can affect the way that ayahuasca acts in the body. There's no known way to predict the effects of ayahuasca in the body, which is one of the main challenges of using it in clinical research. However, studying these genes may help scientists to better understand the workings of the brain. These genes are the human cytochrome P450 isozyme, which is responsible for the metabolism of many drugs, the monoamine A gene, and the serotonergic receptors 5-HT1A, 2A, and 2C, and the trace amine associated receptor TAA-R6, and the sigma receptors SIG1R. For more information about herbs, supplements, and natural treatment plans, check out my website.